Hello everyone, good evening. Can you all hear me? Hello, good evening. Can you hear me? Sophia, can you hear me? Hello, Sophia, can you hear me?
Yes, I can hear you, sir. Good
Yeah.
evening.
Thank you, thank you. Good evening, everyone. Welcome to class. Welcome to class. We are in our week 4 of the JIIPCC Mentorship and Internship Program for the Medical Health Tech and Law class. So far, so good. We've had quite an interactive engagement starting from week 1, where we talked about introduction to medical health, and then we discussed patients' rights. We discussed healthcare fraud and abuse, and now we'll be talking about e-health and emerging issues in e-health tech. All right, so I am very, very sure that we would really, really have a wonderful class. And I hope we're all ready. You all know the drill. We'll be taking presentations first. But before we do that, just a quick welcome to our mentor, Mr. Ebenezer Iguatu. Um, well, Mr. Ebenezer has been an excellent mentor so far. He has kept us on our toes, helping us run through the sessions and giving us both practical and inside knowledge into health tech law in Nigeria. Welcome, sir. I'm not sure if you're on call yet here, but we want to say a big thank you, sir,
I
for
am here,
everything that you do.
Dennis. I am here.
Oh, okay, sir. Thank you very much, sir. We want to say a big thank you for everything that you do for us for within the program. So please, for the mentees on the call, please, can we kindly reach out
I have a
the
concern. You have only 2 participants here. Where are the other
yes,
members of the class or cohorts?
yes,
That's
sir.
one.
We want to reach
Secondly,
out to them.
you shouldn't be the one reaching out to them. You shouldn't be. They are the ones coming to learn. They are the ones coming to learn. You shouldn't be the one reaching out to. That's another thing. Again, I dropped a video on the platform about 5 minutes ago. So while you are reaching out to them, I put an instruction there. Everybody should watch the video before the class. So today's class is going to be quite short because I have an engagement. So can the 2 persons here, the video is less than 2 minutes. Can you watch the video and come back to the class quickly? Dennis, you can utilize that time to reach the other members of the class.
Oh, all right, sir. We'll do that. I'll do that as quick as
Okay,
possible.
if you
Please
just
be
joined,
getting the.
I can see Victoria has joined. There's a video I shared on the WhatsApp platform. It's just 2 minutes. Quickly watch that video and
Okay,
join the
sir.
class. Everyone, Madam Eka, good afternoon. Welcome. Joshua, there's a video on the platform. Quickly watch that video and
Sir.
come back. Good afternoon, madam. Welcome. There's a video I dropped on the platform about 5 minutes ago. Quickly watch that video and come back to the class. It's very short. They are supposed to have finished watching the video. It's less than a minute. It's about 58 seconds. So if you have watched the video, can you indicate on the chat box? If you have seen the video, can you indicate on the chat box Okay, I think we can make progress. Everybody's supposed to have seen the video now. Yes, Sophia says, I have seen the video, sir. So, at least someone has seen the video. Let group one commence their presentation. I told us that we should engage last week to complete our discussion on evidence gathering, and none of you did that on the platform. Why? Okay, Dennis, you can start. Let group one make their presentation.
Please, group one, if we have our presenter here in class, let's get straight to presentation. Presenter for group one, are you with us? If group one is not yet ready, can we take group two?
Yes, group two can proceed.
Hello, where are our presenters? Group two presenter, are you with us?
Who is presenting for group one? Who is supposed to present for group one? Who is supposed to present for group two?
I'm trying to go through the schedule. We are supposed to have Dorcas as the presenter for group one. She's not available, but we are supposed to have Victoria as the backup presenter. Victoria,
Who is
please,
the alternate presenter?
yes, Victoria, if you are with us, Victoria, please, you can step up and make presentation on behalf of the fan. I can share your slides with you for you.
Yes, sir. Good evening, sir. Good evening, everyone.
Yes,
Good
good
evening.
evening. Okay, would you need help with your slides?
Yes, sir.
All right, just give me a minute. Let me bring up your presentation. All right, Victoria, can you see my screen?
Yes, I can see your screen. Thank you, sir.
Yes, please, let's make it as quick as possible. If you can make your presentation in 10 minutes, let's kindly do that, please.
Okay, sir. So I am representing Group 1, and our presentation focuses on e-health technologies, their adoption, impact, and the legal issues arising in healthcare. We are using Nigeria as our context. Please, you can go ahead, sir. So e-health and technologies are transforming healthcare delivery by improving access, efficiency, and patient outcomes. But these advancements also raise legal issues and ethical concerns, particularly around data protection, patient safety, and regulatory compliance. Thank you. So, definition of e-health. E-health refers to the use of digital technologies to deliver, monitor, and manage healthcare services and health information of patients. Examples of these includes telemedicine, mobile health applications, electronic health records, and wearable devices. And this is quite in contrast with traditional healthcare that brings the patient in direct contact with the healthcare practitioner. So in e-health, the patient does not need to physically be in the same environment or the same location with the healthcare provider. Yes, sir. So telemedicine, this is a key component of e-health, and it involves the delivery of healthcare services remotely through the use of technologies like video calls or ranges from increased access to healthcare, especially for people in remote areas, to reduction of cost in healthcare services. And this brings about continuity of care for patients that might not have ready access to physical healthcare. However, the adoption of telemedicine in healthcare has some limitations. For example, the internet access in some places are poor, and some persons are not digital literate to be able to make use of some of these devices. Then sometimes it is not affordable for some people. And there's also the issue of trust in the use of, issue with trust in the use of technology. Many are still skeptical about the use of technologies for their health. Please, you can go to the next slide, sir. Telemedicine and legal issues. Yes, despite the fact that telemedicine is very helpful in healthcare, it raises some legal concerns. Sometimes there's a risk of misdiagnosis due to the absence of physical examination. And despite the fact that an healthcare provider might be providing services to a patient remotely, is still expected to comply with the standard of care that is expected of him while attending to a patient physically. So this might bring about the liability for negligence. And the National Health Act provides for informed consent of users of health establishments. So even when a healthcare provider is attending to a patient remotely, it's still expected to have gotten the consent of the patient is attending to. The next slide, sir. Now in Nigeria, there is no specific law regulating telemedicine. Though I'm aware of a bill, but it has not been passed. But there are some other laws. I think we are going to talk about it in the next few slides. So you may go on to the next slide. Data security and privacy. The data security and privacy simply refers to the protection of patients' data. And under the Nigerian Data Protection Act 2023, health data is classified as sensitive personal data, and because of this, it requires a high level of protection. So healthcare providers should ensure confidentiality while dealing with patient data. Then the Constitution of Nigeria also provides for the right to privacy, and the health data and patient data that are collected should not be accessed illegally. I mean, this data should be protected in a way that people don't have illegal access to the data. The next slide, sir. Wearable technologies. And this refers to devices like smartwatches and fitness trackers that allows for monitoring of health indicators like the heart rate and activity levels. They are helpful in preventing, they are helpful in preventive care and patient engagement. But sometimes this also raises some legal issues, like who owns the data that is being imputed in these devices, and how about the accuracy of information that these devices gives to the patient, and then who is liable when this data leads to harm. The next slide, sir. E-health interventions. These include, e-health interventions include mobile apps and online platforms used for managing diseases and promoting health. They are very useful in managing chronic conditions and improving patient outcomes. However, some of these platforms are not strictly regulated, and this raises concerns about patient safety, misinformation, and professional liability. So please, you may go on to the next slide, the ethical principles. So the ethical principles that guide healthcare also guides e-health, and it includes autonomy, beneficence, non-malfeasance, and justice. I think we have discussed this over and over in the past. So I'll just go on to the next slide, sir. So the legal framework, yes, like I said earlier, there is no single law that regulates e-health in Nigeria, but we can glean from the National Health Act that provides for consent and confidentiality, the consent of patients, and then the confidentiality of information disclosed to the health provider in the course of patient and medical practitioner relationship. Then we have the Nigerian Data Protection Act that regulates the collection, storage, and management of health data. Then the Constitution of the Federal Republic of Nigeria, Section 37, provides for the right to privacy. And this applies to patients as well. Then we have the Patient Bill of Rights, as we discussed in our previous class too. The next slide, sir. Telemedicine, misdiagnosis, and breach of standard of care, then data breach and violation of Nigerian Data Protection Act, which relates to privacy rights. So when there's a misdiagnosis, it may amount to breach of standard of care, and breach of data also violates the patient's right to privacy. So when these devices or platforms are being used, healthcare providers need to pay attention to this so that they do not incur liabilities. The conclusion, sir. So in conclusion, e-health significantly improves healthcare delivery by increasing access and efficiency. However, it introduces legal and ethical challenges. So there's a need for stronger and more comprehensive regulation in Nigeria to ensure that patients are safe and that their data are protected. Thank you.
All right, thank you very much, Victoria, for stepping up as the backup presenter to make presentation on behalf of the group. Please, can we have the group C presenter to quickly make presentation for the group? If you need help with your slides, you can just let me know.
Good evening, sir. So please, I will need help with
Yes,
my
good evening.
slides.
All right. 1 minute. Let me get your slides for me.
Okay, thank you, sir. So, good evening, everyone. I'll be taking us through the legal and ethical landscape of electronic health and its emerging technologies. Okay, please, you can move on to the next slide. Thank- So, imagine a situation or a scenario whereby a patient, who needs urgent medical attention, but the nearest specialist is hours away or miles away the from where the patient can reach or from where the patient is. So, of course, today with just a smartphone and internet connection, the patient can consult the doctor for first aid remedies. So that's the background of electronic health. So now defining electronic health. Um, Electronic health is the use of digital information and communication and communication or technologies, that's ICT, to deliver, manage, and enhance healthcare services. So, the core objective of electronic health is shifting from traditional paper-based systems to integrated digital platforms for real-time patient-provider communication. And its key components include electronic health records, mobile health apps, and health information systems. Okay, please, move on to the next slide. Hello, sir. Please, I'll move on to the next slide. Okay, thank you. So now moving on to um, a broader view of what e-health is all about, we have to look at telemedicine and telehealth. So e-health is not just one system; it's made up of several components. So now, telemedicine focuses on clinical services. So it refers specifically to the remote diagnosis and treatment of patients using technology. While telehealth, on the other hand, is broader. It includes telemedicine, but also covers health education, administrative services, remote monitoring. It's broader in scope. So, according to the World Health Organization definition of telehealth, it describes it as a delivery of um, healthcare where distance is a critical factor using ICT for diagnosis, research, and education. Now, what informed this adoption? That's the adoption catalyst. What informed it? The COVID-19 pandemic significantly accelerated the global and Nigerian adoption of remote healthcare solutions. So, we can all remember when COVID-19 pandemic was ravaging everywhere. So there was, an influx of patient consultation, physical consultations at healthcare centers. So they had to adopt this practice. So now moving on to the place of practice and telehealth licensing and regulation. So this is one of the implications of telehealth services, telehealth adoption or telehealth methods. So the place of practice dilemma is quite prominent. Traditionally, providers are licensed where they physically practice, but in telehealth, determining this place is legally complex. So the question then arises that who the question then arises that what jurisdiction does this licensing and regulatory framework fall under, and also there may be conflict of laws between such regulations or such jurisdictions.
Hello, Elijah. Can you hear us? Sorry, it seems like your voice is breaking. Please, can
So looking
anyone
at the
hear?
Nigerian framework for the Nursing and Midwifery Council of Nigeria for nurses, but currently there are no specific.
Okay, I think he's having network issues. I don't know if he's back with
Back
us.
now.
Elijah, are you with us?
I'm back now.
Okay,
Thank you,
please
sir.
go ahead. Right,
Okay.
please go ahead.
So please I'll move on to the next slide, sir. So now, moving on to artificial intelligence. AI is increasingly being used in healthcare. We all know that for diagnostic imaging, predictive analytics, robotic assisted surgery, and virtual assistants. For instance, AI can analyze thousands of medical images in seconds to detect conditions like cancer, and is globally recognized by the EU Act, also the US FDA Act, and Nigerian regulations the such Nigerian regulations that are being used, but in line with the principles of Patient Bill of Rights, such as the National Health Act and the Nigeria Data Protection Act. So, however, AI introduces a major issue known as the black box problem. Please, I'll move on to the next slide. Yes, the black box problem, and this means that even the developers of AI system may not fully understand how it arrived at a particular jurisdiction, a particular decision. So, acquiring a judgment from AI or acquiring it and applying it like a clinical judgment is um, very risky. There's risk associated with it, as AI may not fully, you know, give the exact description of what really occurs in someone's body. So the black box is, of course, many AI cannot explain how they reached a decision. So this complicates transparency. And the proposed solution here is a human in the loop model where AI supports but does not replace clinical judgment, thereby preserving professional accountability. Okay, please, to the next slide, sir. So now moving on to the ethical implications of genetic testing. Another emerging area under this issue is genetic testing. So this involves analyzing the person's DNA to predict diseases or health risks. So while this is beneficial, it raises serious ethical concerns such as informed consent, genetic discrimination, privacy of sensitive genetic data. And for example, if someone's genetic data reveals a risk for a disease, should employers have access to that information? So this is an ethical dilemma. So unfair treatment by employers or insurers based on genetic predisposition, eugenics, which raises fears regarding design babies and selecting specific traits just for you know just for societal purposes. These are also ethical dilemmas in the use of AI or genetic testing. Please, I'll move on to the next slide. Sir. So now moving on to data ownership and IP, that's intellectual property. In e-health, that's electronic health, vast amounts of data are generally generated. So the question is, who owns this data? Now, looking at the ownership status, Nigerian law does not confer absolute ownership of patient data to either the patient or the hospital. Um, Similarly, AI systems used in healthcare may be protected under intellectual property laws, which would raise questions about access, control, and commercial use. So there's this issue of custodian versus subject issues. So hospitals are custodians of health records pursuant to the National Health Act of 2014, while patients are data subjects with rights to access and erasure under the Nigerian Data Protection Act 2023. So IP in AI, AI cannot be an inventor or owner of a patent under current law. Ownership typically resides with the human developers. So everything still falls back on the human developer of the AI. So because if this is not done, it will result in identity theft or stigmatization or loss of trust in healthcare systems. So moving on to the next slide, sir. Now looking at data privacy and cyber security. The Nigerian Data Protection Regulation and the Nigeria Data Protection Act enforce principles of consent and data minimization, just like what we looked at last week, the Patient Bill of Rights. So these are um, acts or enactments that protect the patient's data and controls access to patient records. So when these are not done, of course, systems we know that systems are vulnerable to hacking and malwares and ransomwares. So, but when these data are not very well protected, it will lead to loss of trust in healthcare systems. It will also lead to stigmatization, and this is why strong legal frameworks and compliance measures are very essential. So moving on to monetization, patient data has high economic value, but unauthorized commercial use without explicit consent would violate the patient's constitutional rights. That's section 37 of the Constitution. So um, using the patient's data for commercial use is a violation of the patient's rights when it's unauthorized by the patient. Moving on to the next slide, sir. So now, what are the barriers to adoption in Nigeria? So now, despite the benefits, Nigeria faces several barriers to adopting e-health technology, such as poor internet infrastructure, lack of electricity, low digital literacy, high cost of implementation, data protection concerns, lack of regulatory clarity. For example, many rural areas still struggle with
Presenter.
when
Okay.
so many rural areas still struggle with regulatory clarity. Moving on to the next slide, sir. So in summary or summarily, e-health and emerging technologies have the potential to, revolutionize healthcare delivery, making it more accessible and efficient. That's the importance of adopting e-health technology. But however, we need to integrate ethical guidelines, emphasizing transparency, consent, and fairness into all healthcare innovations. So it is thereby recommended that clear regulatory frameworks should be adopted for telehealth and AI. There should be standardized licensing systems across various jurisdictions. There should be strong data protection and cybersecurity laws. There should be public awareness and digital literacy programs. There should be ethical guidelines for AI and genetic testing. Moving on to the next slide, sir, please. So, the final thought is that balancing innovation with patient safety and legal accountability is essential for a trustworthy digital healthcare system. Moving on to the next slide, sir. That's it. So ultimately, technology should not only make healthcare more advanced, it should also make it more ethical, safe, and equitable. Thank you, sir.
All right, thank you very much, Mr. Elijah, for stepping up to make presentation on behalf of your group. Well done to you and to your team for putting the presentation together. Mr. Ebenezer, we would like to get back to you for your thoughts on the presentation and for your discussion in today's class.
Okay. Thank you very much. Okay, I commend the two presenters and the group work. However, I need to observe that while I understand maybe what they intended to achieve, that is group 2 with their slides by the visuals, but you can see or agree with me that the visuals made the work untidy and the visuals became more of distraction. So when you are using visuals, you use it sparingly and you use it strategically. You can see there are places, let me look at this. There are some places that the visual was blocking the content on the page. Okay, look at page 2 or slide 2 rather. You will see where they have some thick lines. This one is supposed to be a pen. You see that if you are just presenting this, that thick line of the pen and the other one is already blocking the contents that was written. If you scroll down again to slide 4, you will see a similar thing. So when you are using visuals, either you fade them so that they don't cover, or you put them by the side. You put them by the side. So barring that, I commend the depth of the research. So now to the business of the day. I don't even know whether to start with. Okay, let me start with group. Telemedicine. I think it was in our first lecture that we made passive reference to telemedicine. It is healthcare delivered through telecommunication. Healthcare, if you look at it, the use of the internet. So, as opposed to your physical one-on-one visit to the doctor, you sit on this other side of the table, the doctor is on this side, and you consult and go. Telemedicine is healthcare delivery that seeks to bridge the gap caused by distance. And why is it important? It is important because it saves time. It saves resources for the patient. It saves the patient the risk of transportation, whether by air, by land, by sea. Okay, it wasn't in this class I mentioned it. There are 3 major delays that lead to death in the hospital. 1 is delay at home. 2 is delay on the road. 3 is delay within the hospital environment. So you now see that telemedicine has solved 2 delays. Delay at home. In fact, the 3 delays: delay at home, delay on the way, delay at the hospital. So if there is emergency, instead of driving to the hospital to get the doctor before you start treatment or get any medical help, with a phone call, by booking a session, the doctor can easily attend to the patient, and the patient will get at least first aid, direction, instruction. Okay, do this, don't do this, do this, don't do this. A classical example is the lady that suffered a snake bite some time ago. Even though her case is pathetic, she made it to the hospital alive. But assuming she wasn't in the city and she was far or wasn't mobile, because we understood she drove herself to the hospital, meaning she had done some first aid. In fact, she tied the hand. But assuming that was not possible, if she didn't know what to do, she would have just put a phone call across. Okay, this is my situation, this is my challenge. And she will be getting direction of what to do. Carry the hand this way, don't carry the hand this way. Now, that's an advantage of telemedicine. But are there disadvantages? Of course, there are disadvantages. One of the serious disadvantages of telemedicine now is data breach. Data breach is a serious issue because there are people whose business is just to cause trouble anywhere in the world. That's what we have discovered. So there are people who are hackers. They just go about us just to cause trouble, to extort money. So a hospital or a healthcare organization or facility that is into provision of telemedicine medical services has to, first of all, ensure and guarantee the confidentiality and the safety of the data that of their patients. So that brings us to issue of regulation. If you look at the Code of Medical Ethics, there is I mentioned it here in the last class, I think the first class. There is a clear provision for telemedicine as far back as 2008, when that Code of Medical Ethics was written. However, there is need to review that Code of Medical Ethics and bring in current position of affairs, given the level of development we have had technology-wise. Given, okay, you watched the video I shared on the platform. That's just to show how technology could be used. Just one way. If you listen to that video, it says that the workforce, the time, the use of technology saved 90% of the time wasted by doctors engaging with patients, working to go and get drugs and all that. Now, as at 2008, when the Code of Medical Ethics was written, that technology was not in place or was not rampant the way it is. If there is need for a revisit, there is need for revision of the Code of Medical Ethics. 1. 2, there is also need to have a clear-cut regulation as their agency. So if you want to practice telemedicine in Lagos, you have to be registered with them. But note that anybody who wants to, because it's also a challenge, before you can practice as a telemedical service provider, you must have been a qualified medical doctor, certified and licensed to practice by the Medical and Dental Council of Nigeria. So you see that we also run the risk of quackery. Some people can come together and present to be a telemedical that the persons who are going to register and float the company, we actually form a company, a telemedicine company, and float it. But where the challenge is the people they refer you to. Because the way it operates is you that can handle your problem. If it is a kidney problem, they refer you to a nephrologist. The nephrologist takes over from there, consults, asks you questions and all that. If it is a heart-related problem, they refer you to a cardiologist. If it's cancer, they refer you to an oncologist. Now, the question is, how do we ascertain that this person they referred you to, as at the time he's making that consultation with you, is qualified to practice medicine? Now, the same way lawyers pay their annual practicing fee, That is how medical doctors or healthcare professionals, that's how they pay their annual practicing fee. In fact, their own is our own. You pay till 31st March of the year, then you renew. You have the 31st March to renew. It is the same thing. Their own, you must renew on the eve of the expiration. For example, if your practice license will expire on 1st of April, by 31st of March, you must renew it, so that by 1st of April, you will still be qualified to practice medicine. So what happens where the person says, okay, I will renew it, and forgot, and the thing expires 31st March. By 1st April, the person, midnight 1st April, the person gets a call. As at the time he got a call, under the law, the person is quack. Because as at that, yes, he has the knowledge, yes, he has the certification, yes, but is he qualified to practice at that moment? The answer is no. That is on the one hand. On the other hand is people who are not qualified at all. I will drop some excerpts, some clips of the interview I had on Friday on the platform. I had an interview on blood donation and blood transfusion. And one of the participants here was with me on that in the studio. They begin to refer you to persons who are not qualified. Clip. I think I have that clip on my Facebook. I will just drop it on this platform. We watched a clip of medical laboratory scientists who lost his job and was now on the street, or rather, he went to the street collecting blood from drug users. He just said, "Okay, you won't sell your blood." Then the person he was buying a pint of blood from them at 5,000. Now this blood are on screen, and he will take it, and co-professionals. This person was licensed. Then his co-professionals will come and buy that blood from him. Now this is physical. Imagine what will now happen virtually. So I'm painting these pictures to see the high possibility of quack attending to patients who do not know that they are being attended to by quacks. So it is also a serious challenge. Then regulation. There is no regulation. In fact, we are behind as far as our laws are concerned. The law is not our laws in Nigeria, not just health law. We play catch up. We take too much time to catch up. And by the time we are catching up, the world has advanced again. So there is so much gap, legislation-wise, to regulate telemedicine. We look at small watches, these smart watches, and other devices. In fact, there's this, there is this, okay, I'm diving into e-health. I don't want to do that. We look at regulation. There is a gap. Like I mentioned, Lagos State already has their guideline, then the Medical and Dental Council. But apart from these two, there's a bill pending before the National Assembly. So what is delaying it? Sometimes group interests. Let me explain what I mean by group interest. Now, that telemedicine bill will be sponsored by telemedicine practitioners. Why are they sponsoring it? So that they can do their business legitimately under the law. But you now look at that bill, you will see that maybe things that will protect the rights of the patient, things that will protect the rights of the user, is not adequately captured in that bill. Why? Because the purpose of the primary interest of the bill was not to protect you, the patients. It was to legitimize their business. So issues as to thoroughness, issue as to consent, you will not find it there. Victoria, during your presentation, you made mention that the National Health Act, you will see informed consent. Now, in the National Health Act. Now, let me disappoint you. It is not there. It is not expressly stated there. You won't see it. The only place you will find it is between section 40, I think section 48, talking about dealing with blood and tissue and organ harvesting. So that's the only place they say a person can be treated. In fact, it gave the pay, it guaranteed consent and also withdrew consent immediately. And that is because some of these things are sponsored by businessmen who want their interest or business interest to be protected and not necessarily to have the interest of the users. I'm going to read section 48. That's the only place you see consent. It says, subject to the provision of section 53, a person shall not remove tissue, blood, or blood products from the body of another living person for any purpose except A, with the informed consent of the person from whom the tissue, blood, or blood product is removed, granted in the prescribed manner. B, you now see where they deny the consent. B, that the consent clause may be waived for medical investigation and treatment of emergency cases. Now, the question here is, what kind of, is kidney, because we're talking about blood tissue here, is it an emergency such that you need to waive consent? We say that the patient is the master of his body when we discussed autonomy. So I pointed this out to show you how the framing works, because some people are behind. That's okay, we push this bill for us. It's the same thing that is happening in telemedicine. So for now, there is no bill, and it is a serious issue. Then again, another challenge is there is no law rather governing telemedicine. Another challenge is finance, internet availability. If you go to our villages, what you mostly see is these small phones with touchlights. So even if there is internet, the person does not know how to operate the phone, except the small one that we use to just make call hello, hi. So you see that illiteracy on the part of majority of rural dwellers as to how to navigate the internet and get the result they desire is a challenge. Then, of course, getting data. You are consulting, okay, this class, the minimum we spend here is 1 hour every day. The class starts from 4. It is 4 to 6. So all of you that are on this class, we are going to be here for 2 hours. Minimum 1 hour, 30 minutes, at least 1 hour. How many of the rural dwellers have the mind to buy data and sit to consult with the doctor? So you see that it is also a serious challenge. Finance on the parts of the doctors. Then issues of risk. Possibility of misdiagnosis is high. Why is it high? The cardinal principle of diagnosing is you must see what you are diagnosing. You must feel, you must touch. That is why, because different ailments have some ailments have similar symptoms. For example, headache is not sickness, it's not ailment in itself. Fever is not ailment in itself. They are symptoms. So if you say you have headache and you are feeling feverish, the doctor might ask you, do you have cough? If you say yes, he say, when you cough, do you cough? Does your chest pain you? You might say yes, or he's continuing his diagnosis. But if he was seeing you physically, he can feel your body. He can press some areas and ask you, do you feel pain here? Do you feel pain here? You know why? Because it is not one sickness that only has that symptom of when you cough, your chest pains you while you are feeling feverish and having headache. It is not only one sickness. So there is a high chance of misdiagnosis because you have, even if it is a video call, yes, on video he can say, press your uh, uh, left side of your abdomen, press it well. Do you feel pain? You will answer yes or no. But it is still not the same as to where he's there observing you. So you see that there is high risk of misdiagnosis through telemedicine. Now, the proper practice is that as soon as you consult with a patient, you test center or clinic, because telemedicine is actually an integration. The what is it called? The internet or the social media, the medium of communication is just a platform, either via WhatsApp or via Zoom, as we are doing now, or any other platform or phone call. It is just a medium. But the proper practice is, after that consultation, you are supposed to refer the patient for physical examination. So you now see that there is also high risk of medical negligence where the person consults only on phone, prescribes without referring the patient for physical examination. Telemedicine is not just, okay, you are in Calabar, I'm in Abuja, this is your problem, then you stay there. No, it is just to bridge the distance. It doesn't mean that the patient will never visit the hospital for physical examination. No, it is to make treatment quicker and faster and save time. Then another issue is the use of technology, electronic health record, wearables. I was talking about smart watches before, and that is where our standard organization comes in. Every day we keep lamenting that this is substandard, this is substandard, this is substandard. If you go to our ports, you will see standard organization there, you will see customs there, you will see other agents, you even see NAFDAC there. So if they do their work well, these substandard stuff will not find their way here. So there is the risk of harm due to substandard blood pressure wrongly. Just like that.
Hello, sir. Can you hear us, sir? Okay, it seems Mr. Ebenezer is having some network challenge. Sir, are you back with us, sir? Okay, it seems Mr. Ebenezer is having some network challenge. Sir, are you back with us, sir? Okay, it seems Mr. Ebenezer is having some network challenge. Sir, are you back with us, sir? Okay, it seems Mr. Ebenezer is having some network challenge. Sir, are you back with us, sir? Okay, it seems Mr. Ebenezer is having some network challenge. Sir, are you back with us, sir? Okay, it seems Mr. Ebenezer is having some network challenge. Sir, are you back with us, sir? Okay, it seems Mr. Ebenezer is having some network challenge. Sir, are you back with us, sir? Okay, it seems Mr. Ebenezer is having some network challenge. Sir, are you back with us, sir? Okay, it seems Mr. Ebenezer is having some network challenge. Sir, are you back with us, sir? Okay, it seems Mr. Ebenezer is having some network challenge. Sir, are you back Hello, sir.
Oh, did I what? I didn't even know that I went off. I have been talking. What did you hear last, please?
Oh, I think you said you were mentioning something around electronic health challenge before when I stopped
Electronic health.
hearing you. Challenge.
Hey, Jesu, I haven't. Yeah. Sorry. Okay. Let me see if I can trace back. Electronic health challenge. Hello.
Yes, sir. I can hear you, sir.
Hello. Can anyone hear me?
Yes, sir, I can hear you.
Yes. Can you give me the last sentence you heard?
Okay, I said for my own end,
On
I don't
the
know if
last thing
it was
I
the
remember, not
same with
just a
the
word, but
rest,
like
but
a
I
sentence
think
on the page.
okay.
Hello.
Okay, so you were talking about the Standard Health Organization where they come in with wearable devices. I think, can you hear me, sir?
Standard Organization of Nigeria. Hello.
Yes, where they come into
What's the
play
problem?
with regulating things around wearable health device. Can you hear me? Hello, sir. Hello, sir. Can you hear us, sir?
Yes, I can hear you. I say, was it Standard Organization of Nigeria?
Yes, you were talking about where they come in terms of regulating devices, some of those wearable devices. I think that was the last place I had around that last sentence
Okay.
I
So
had
I was
you.
saying that if our regulatory agencies, yes, we do not have law regulating telemedicine, but there are other regulatory bodies that can help us and ensure that our equipment are standardized. And I say that if you go to our ports, you will see Standard Organization of Nigeria there. You will see NAFDAC there. You will see Nigerian Customs there. These people are there, but substandard equipment still find their way into our country. And I said that what happens where somebody blood pressure reading, he acts. And in acting, maybe taking medication when he's not supposed to, or taking a stronger medication to crash the blood pressure, and he has a challenge that we will not be able to quickly trace it to that place that this was the cause. That our people are not sophisticated yet in that level of investigation. Not that we cannot do it. So I am saying that there is still much work to be done in terms of regulation. We have the Data Protection Act that provides even for how to process data. And health data was specifically mentioned, I think, in section 30 of the Data Protection Act. We also have the cyber security that talks about interception and interception of data, but it made reference to national data. I'm trying to get the exact word that was used there. It makes good national data infrastructure. National data infrastructure, something like that. So interception of your own data too is an offense under the national health, under the cybersecurity law. But Act. We have Data Protection Act. We have Cybersecurity Act. Not, in fact, the Data Protection Act, the Cybersecurity Act was just reviewed 2024. Now, nothing stops them from linking the Cybersecurity Act to data protection because somehow they are connected. National Health Act, to connect it, or in the making of the new Telemedicine Act that is before the National Assembly, to link it to cybersecurity and data protection, so that way the law will be stronger. Then another challenge we have with our laws is, even when the laws are made, the enforcement mechanisms are usually weak. So you have laws, there's offense, there's a penalty, but the enforcement mechanism in the law becomes weak. So on the whole, telemedicine is still a growing, in fact, there's serious growth. Companies are beginning to hop into telemedicine. In fact, as I speak, about 2 months ago, one approached me. They want me to be their lawyer. We are still discussing that now. So companies are springing up by the day, but it is important to be there because they will also come to you to be their lawyer. It is important for you to know where and how to guide them. Then let's look at electronic health. I shared a video on the platform and I told us to go and watch it. You see, China is, I don't know how to put it. China is a world of their own. They are not anywhere. We are not sharing anything with them. We are not sharing anything with them. Now, what you saw in that video is how far technology can go in advancing healthcare. So here too, we still do not have laws that regulate electronic healthcare, but we are beginning gradually. In fact, not gradually. We are integrating seriously a lot of record keeping to start with to electronic. Now, what it means is that if you go and watch the video I posted on Abia State Primary Health Care Center improvement, that's a classic example of e-health. You will see that one of the speakers said from there, from the desk, as they are consulting with the patients, they are also consulting with other professionals in other parts of the world. So if your case becomes difficult for them, there and then they can connect and consult consult with a consultant and give you instant reports. What it means is that if that consultant demands for your record, with a click of button or two, your record will be shared and results will be sent back. Now, that is serious advancement. Prior to this time, what we'll have is you will go to the hospital and apply for a medical record. They might tell you to come back next tomorrow. They might tell you to come back in 1 week time before they will photocopy the medical record and give you. Then you'd have to use DHL to now send it to the other countries where the doctor is assuming he's out of Nigeria, he's outside Nigeria. So you see that electronic health in attending to healthcare needs of
Hello everyone, good evening. Can we all hear me? Sorry, I'm also experiencing some issues with my network, so the network is logging me in and out. Okay, you said you cannot hear me. Hello, Mr. Ebenezer.
from next use Google Meet for my classes, I beg. Use from our next class, let's try Google Meet. Because I had a webinar yesterday and it's Google Meet I used. I didn't have. Please.
All right, sir.
Yes. So, integration of artificial intelligence into healthcare is a development that I'm looking for the appropriate word to quantify because we have no idea what AI can do. Precision, artificial intelligence, precision. This afternoon, I read on a group, there is a new AI integrated diagnostic machine that can test the blood sample and distill 50 different types of cancer from one test. That is precision. Then the supersonic speed of AI in diagnosis and data processing. AI can read tons of can analyze, not just read, can analyze tons of medical reports within split seconds and give you the reports. So if you bring scan results, 50, 100 of the same patients, different scans, AI can go through it in less than 1 minute and give you the results. However, there is a challenge, margin of error, where there is bias integrated in the AI. Now, this bias might not be deliberate, just that the person who programmed the AI programmed it for use in China. So they have used the health data of Chinese to program. And the AI integrated machine has been imported into Africa, Nigeria specifically. And it is being used here. So you see that there will be bias. Even in your ChatGPT, you're prompting, if you already know what you're prompting and you ask ChatGPT question, there are times it will give you wrong answer. Now you are able to decode the wrong answer or detect the wrong answer because you already know the correct answer. So the question now is, what happens where the user doesn't have prior knowledge? Because a lot of people get thrilled with the AI technology, but it also has its challenges, one of which is what I've mentioned, bias. So where AI makes a mistake, you see that it could also lead to death because treatment starts from diagnosis. Once you have diagnosed wrongly, your prescription will be wrong, then you will ultimately administer the wrong medication leading to death, God forbid. So AI is good. However, it requires training. Then issue of, in fact, I commend group 2 for the depth of their research. Issue of data privacy and data security. Issue of IP, intellectual property ownership. So it now becomes very important that you, the hospital, assuming you are the one ordering for the developments, not just buying. There's one video I will send. There's one video, humanoid AI. I will say that video will frighten you. I will drop it on the platform. So if you are the person ordering, you now see that you have to make agreements that cover all this area. Intellectual property ownership, data protection and security. Then you also take guarantees from them regarding the margin of error, 1, and 2, liability. Very important. That the company will be liable where AI, where their products, because it's their products, where their products makes a mistake leading to medical harm. These are areas that are coming up in medical law. Who is liable for machine error? Because prior to this time, we didn't have this level of precision or this level high-tech AI or humanoid AI that can conduct surgery, and the doctor will just be guiding. So these are serious issues. Then we do not have a law. It is painful. I mentioned it that we are playing catch up as a country, and it's a really serious issue. Now, what are the challenges of electronic health? One major challenge we face here is finance. It is expensive. 2 days ago, it's on social media. In fact, it has been circulating for the past 2 days. A church in Abia State, Lutheran Church of Christ, donated MRI machine, $1 million to a hospital in Abia State, to the Abia State government. Did you hear what I said? So you see that how many hospitals, let me say how many private hospitals, I don't want to talk government hospital, how many private hospitals we use $1 million, not 1 million naira, to buy one machine. So you see that it is a serious challenge, a huge barrier, finance. Then another issue is power, infrastructure gap. I used to tell people when I train that power, electricity is a critical factor in healthcare delivery in Nigeria. Do you know how many doctors who use their money to buy diesel, to power the generator, to carry out surgery? You have no idea. Are you aware that doctors have been in the middle of surgery? They take lights, the generator is down, they have to use torchlights to conduct surgery, to complete the surgery. So you see that the government has a critical role, a crucial role to play. They have done one, even though people are not shouting about it, but they need to be commended. And what was that? moving power generation from the exclusive legislative list to the concurrent legislative list. Initially, power was solely for the federal government. Now it has been moved to concurrent list where the state governments can generate their own power. And that is what Alex Otti is doing in Abia State, trying to generate their own power. So you see that power is a critical issue. Then digital illiteracy. Our how do I put it now? Our sociocultural and religious upbringing has done us a lot of harm in this regard. How do I mean? We approach any technological innovation with fear, with negative mindsets. The first attribute is that it is the work of Satan, and that is wrong. Satan is not that creative. Satan doesn't create anything. If you read your Bible, for those of you that are Christians, you will see that when God created, before even God created man, say, let us create man in our own image and likeness. So it means that the brain inside you is God that put it there. It is not Satan. So this digital illiteracy, our approach, it is when it has gone through in fact, the last stage when it's phasing out. I mean, that stage of innovation, when it is phasing out, other parts of the world have used it, and it is phased. That's when we now dive in here. Because, okay, I don't know. I didn't save that video. I don't know why. A son took the mother to a hospital, and they needed to put her in one machine. The machine she will lie down on the machine, not MRI. They will cover her up to her chest. The machine actually looks like a casket. Do you know that this mama jumped out of the machine and said that the son wants to use her? This is true life story, another woman. This mama jumped out of the machine that they want to use her for ritual. The son had to enter the machine and come out to convince mama to enter the machine. So you see what illiteracy can cause for us. It is a challenge. So what is the way forward? One, aggressive advocacy, massive advocacy, education. In fact, the class, I am aware some people have taken steps. I am aware somebody in this class is doing a master's degree in this area. So if you want to do your master's, this is a good place to start. Go and get master's degree in medical law. As we are looking at every aspect of the class we have, every topic we have been looking at, settle in your mind the one that is challenging, agitating you the most. Take it up, go and acquire knowledge in that area and say, I'm going to solve this problem from this angle. And you begin advocacy along that line. You begin to write papers along that line. So solution is knowledge acquisition from you, the advocate. So you acquire the knowledge first, because you cannot teach, you can't give what you don't have. Knowledge acquisition. Then secondly, now advocacy. Now this your advocacy, stakeholder engagement, engaging the government, engaging regulatory bodies, engaging with the Commissioner for Health, Ministry of Health, engaging with relevant stakeholders, because it will shock you that a good number of them do not also know. Engagement with our legislative drafters or our legislatures. Let me shock you. In 2020, I had the privilege of a legal team that
Mr. Ebenezer, are you with us, sir? Hello, sir. Hello, Mr. Ebenezer, are you with us?
oh, did I go out again?
Yes, you were not on the, or were
Please,
the other
next
members of the group?
class, use Google Meet. What
All
did
right,
you
sir.
hear last, please?
For me, I heard you were talking about executive legislation, just around something around that, sir. My network is also not so
What?
good, sir, so I'm not hearing everything
Okay.
properly.
I said that one problem, the power problem has been solved partly by the government. And what did they do? Moving the power from moving power generation from exclusive legislative list to concurrent legislative list. Meaning before, it was only the federal government that can make laws. It was only the National Assembly that can make laws regarding power generation. But now, the state government can also make law regarding power generation. That is what the governor of Abia State is doing. Oh, that means you people lost me for a long time. So I said again that the solution we have is firstly knowledge gathering by you, the advocates. Before you go into advocacy, you should have the knowledge yourself. And I said I'm encouraging you that beyond this JIIPCC mentorship class, you should go further. Some of you can go and take up a master's degree up to PhD in medical law. We have a PhD candidate in this class, medical law. Yes, PhD candidate in this class, and I'm impressed. So you can go take up a PhD in medical law so that you have the knowledge, then you can now begin to advocate. I also say that all the topics we have been treating, you should pick out one that agitates you the most, build capacity in that area, and become an advocate in that area, in that particular area, so that you sensitize people. Then I now talked about stakeholder engagement in your advocacy, that the advocacy will not just be to sensitize the public, but stakeholder engagement, starting with our legislators. That's why I was saying that sometimes they do not know. Engage with the ministry. They are civil servants, so they are just occupying office. They are not medical lawyers. Yes, some of them are medical doctors, but they are not in practice. They are civil servants. In the morning, they wake up, go to the office, do government work, and go home. They are not in the field. They don't know the latest or current developments. Yes, they might be in policy, but they are not in the field. So I now give an example. I said that in 2020, during COVID, I had the privilege of serving with the mobile courts that was enforcing lockdown and sit at home lockdown, yeah? And that we found something intriguing and embarrassing too, that the regulation we were using, COVID regulation 2021, was imported. It was copy and paste that the drafters did. They just copied COVID regulation of Singapore and plastered it here. and that they were not diligent enough to delete Singapore on the document. You are carrying a document, you read part of it, you see Nigeria, you read here, you see Singapore. So, and I'm saying that there is need to also engage with our legislators and educate them. They are politicians. We have seen them. You see them on TV. You see their submission on the floor. You see that sometimes what they are saying is far disconnected from the subject matter of discourse. So we need to also educate them in our advocacy. We need to engage with them. So that way, even our regulatory bodies, we need to engage with NAFDAC. We need to engage with SON. We are discussing the challenges now. They are not in this class. They are doing their work as civil servants. At the end of the day, they get paid. Yes, somebody may collect bribe to solve his immediate need and allow substandard goods to enter the country. But does the person know who will be the next victim? It could be his family member. So by the time we engage with them and tell them they need for them not to allow substandard materials to enter the country, we are also solving these problems. Thank you very much. Any question, please?
Thank you very much, Mr.
Any
Ebenezer, for
question?
running us through. Please, do we have any questions from the mentees? Please, I encourage us to ask questions. Let's ask questions. Do we have any questions from Mr. Ebenezer? Hello, can we all hear me? I noticed that we've been very quiet in class. Please, are we in this session?
Yes, we are.
All right. So no one has a question.
Okay.
Please, I want
Yes,
us to. Okay, Zoom
Okay,
user,
ask
please,
your question,
can you
please.
hear me? Please go ahead and ask your question.
Ask your question. Who is Zoom user?
Okay. If she's not ready, please we remember we can use the chat box to send our questions. If probably you are not in a place to speak, you can send your questions into the chat box and we'll read them out. And please, I want to encourage us. In our research work, what's part of the requirements is that people are supposed to get questions that people are supposed to engage with the mentors. All right, and so let's make it a habit where we get to generate questions while doing the research. I think we still have two sessions to go, if I'm not mistaken. Right, let's get on board trying to ask as much questions as we can in class. It doesn't necessarily make sense that we go through a 1 hour discourse and there are no questions from the end of the mentees.
Okay, I have a question. I forgot. It's
Yes, please
about
go
the
ahead.
video Mr. Ebenezer shared concerning that doctor that harvested, is it parts to save children? I wanted to know his opinion on that scenario.
Okay. Now, that is a classical example of what you find when we talk medical ethics. A clash between standard procedure and the need to save life. But there is no justification. There is no justification to violate or for violating the standard procedure. The child's parents were not dead. Do you get it? The child has no consent to give. They would have gotten consent from the parents. The intentions were right. Okay, I will answer your question. The intentions were right, but the process of actualizing that intention was wrong. And you know, the law has no emotion. The law is different from morality. The law will take its course. Do you understand, madam?
Yes, I do. Yes, I do.
Yes. So what you would have done, assuming the parents declined consent, we have had a similar case in Nigeria. Assuming the parents declined consent, you would have gone to court to get a court order. The court order will supersede the consent of the parents that had been withheld. In the case of a Sabona against Dr. Fawaye, that case, a minor, a little child, was born to Jehovah's Witness parents. The child was sick, and the doctor wanted to transfuse blood. The parents of the child refused, saying that child cannot be transfused because of their religious belief. The doctor didn't go ahead to transfuse the blood. Rather, the doctor went to court and secured a court order permitting him to transfuse blood to that child. And he transfused the blood and saved the child. The parents of the child now sued the doctor and even the magistrate that gave the court order. The matter got up to Supreme Court. And the Supreme Court, among other things, held that the child had no religion because the child was a minor. You do not know whether upon attaining maturity, he will want to be a member of Jehovah's Witness. Do you get it? So the proper thing to have done in that situation is to approach the court, get a court order, then continue the surgery with or without the consent of the parents. So you see that if he had approached the court, she would have still done what she wanted to do to save the life of the child, but within the ambits of the law. Now, do you understand it?
Yes, I do. Well, please, at the case you just cited, I didn't get
Okay, I will post
the
it on the platform.
okay, thank you.
Yes. Esobono against Dr. Fayowa. Then a question here. Okay. Sir, on digital literacy, how can we as professionals help to educate women and men who are of age and are new to this advanced technology, and also when there is language barrier in communication? Yes, that's a good question. That's why I say the first thing I said was knowledge, capacity building. You cannot give what you don't have. You see, passion. If you read the Bible, if you go and read Romans chapter 10, verse 1, you will see what Paul wrote there. He said, Israel, I bear witness. My desire for Israel is that they may know God. Israel, say, my desire for Israel is that I may know God. For I bear witness that they have zeal, but not according to knowledge. So what you have here is passion. You want to educate, you want to make impact. The first thing to channel your passion to, no matter what it is capacity building. That's the first tool of effectiveness in anything you want to do. Capacity. Why I usually ask, why did you come to this class? You see, some people come from because of personal experience. Some people, they are thrilled by medical knowledge, by medical law. They now come to acquire more knowledge. So what you are going to do to be effective in what you want to do in educating people, one, go and learn communication. Now, this communication now is communication for development. Community development communication. It is not ability to speak English. To volunteer for NGOs. And while you are there, you are volunteering, you are doing things, you are learning. When they are going out, you follow them. There is a method to doing everything. So the first thing you need to do, one, capacity building. You are building capacity, gaining the right knowledge you want to communicate, firstly. Secondly, gaining the knowledge on how to pass the information. So where there is language,
Hello, sir. Okay, sorry. Mr. Ebenezer is out. Please, once again, I want to try to use this medium, just this brief period to encourage us to get to make it a habit, with questions, to ask questions. Mr. Ebenezer, are you back with yourself?
sorry, I'll round up. So I said, if you are doing community outreach, you need community. But if it is not a community outreach, you can start from social media. You can use pidgin English. But also, you need to define your scope. Who is your target audience? We have mentioned aged men and women. Aged men and women. So your messaging must be tailored to suit them. The way you talk to them, the way you address them, is not the way you address Gen Z. So you see that it is not only what you want to say, but how you want to say it is also very important. If there is need to get another dialect, do. So once you have your messaging right, and put it in a way that they will accept you, because if they do not accept you, they won't accept your message. So if you're doing community engagement and there are cultural observations you need to do, for example, you are entering a community, they say in this community, women don't wear trousers. You do not say, I am bound by the cultures and tradition of your village. We are city people. Once you take that position, they won't hear you. If you are going to church to do an outreach and they say in our church, women must tie their scarf, relate you and your message. So you must know how to engage. Thank you. But we can continue the discussion on the platform, but for class on Sunday, and you go. I people, Sunday medicine people. There are a lot of issues happening. I want you to also see something that has happened and post it on the platform. How many of you are aware that Jehovah's Witness has changed their position on blood transfusion? Is anybody here aware?
Yes,
Yes,
sir,
sir.
you
I am
posted on the
aware.
platform.
Hello?
You posted on the platform.
Oh, did I? I
Yes, you posted it
didn't
for
know
us.
I have posted it. I didn't know. I thought it was going to be a teaser. Okay, no problem.
Hello, sir.
There's a case I'm going to post for a while now. Then there's a decision on a public health in Lagos State. I'll also share. So I guess that is all. Is there any other question? Let me see.
Sumi user, you wanted to ask a question?
Joshua, you said, but to me, it's still at disadvantage. Can you unmute and speak, Joshua? Let me understand your context. Hello, Joshua.
Okay. It's Joshua speaking now. It's
Yeah.
concerning the
Hey,
information
your
on
line
the
is breaking.
establishment is bad. So what I'm trying to say is that if
Yeah.
okay, can you hear me, sir? So what I'm trying to say is
Yes,
that
yes.
what I'm trying to say is the process in which uh, they bring out the information, like they said that then in case of an emergency they will now use that person's own blood. So why I say this
Patient's blood.
disadvantage because why buy
Yeah,
in so so
they
it's
are
not the
not
patient blood, like
serious.
the patient's blood. Yes, yes, the patient blood is well. So my one question is that why buy in an emergency whereby now that patient's blood now got finished and still yet it's not able to do the needful that he needs to do there. What will they now do next? Is it not to
It's,
check on
I
that
already,
blood? And they say they are still restricting taking outside blood. So
I,
that's what I mean by
I already addressed this in the interview I had on Friday, and in fact, I predicted, and I still maintain it. Two predictions I made. One has already started. In fact, as soon as I read that news, I discussed with a friend, and I told him, one, there's going to be an outrage from people who have lost their parents or loved ones due to their earlier position. So why the sudden shift? I will also share the anger of some people. They are posting it on Facebook. So I made that. In fact, after 2 days, I read it. As I am expecting an outrage from people who have lost their loved ones. Then the second one, I said that in the next 20 to 50 years, it might not be up to this position will be scrapped. Gabadaya, they are going to face a crisis. I didn't make this one, but I'm making it now. They are going to face an internal crisis, which will be either to scrap blood transfusion, Gabadaya, or go back to the earlier position of not receiving at all. Because this one, it doesn't make sense. If the patient is anemic, has shortage of blood, is it from the shortage of blood that you will now draw another blood? Do you get it? And that's what a doctrine of men, misinterpretation of scripture, that's where it can land you to confusion. If a patient has, in fact, I said the implication of this is one, if you live in Abuja, you need to store your blood in Abuja. Then you go to Lagos and store another one. If you are traveling through Lokoja, you drop one in Lokoja. You go to Port Harcourt and store, because emergency can happen anywhere. So if you are traveling along Lokoja and you have an accident, you can now tell them that you have your blood stored at Federal Medical Center, Lokoja. Let them go and take it from there. Do you get it? But it doesn't work. That is it not absurd? Does it even make common sense? Now, that is what religion can do. I didn't say spirituality, religion, and the doctrine of men. Spirituality is you-God relationship. Religion is all these other embellishments that everybody brings as his own interpretation. So it doesn't make sense. I agree with you. But mark my prediction. One, in the next 50 years, 20 to 50 years, it will be abolished. One. Two, there will be more outrage from people who have lost their loved ones. Then three, there's going to be internal crisis. Either we are reverting to the former order or we are scrapping the doctrine Gabadea. But this one, it is not going to stand. By the time they test it for 1 or 2 years, they will see the foolishness, the inherent foolishness in that decision. So, thank you very much. So, look out for the authority. I'm sharing them now so that I don't forget. I'm sharing them now on the platform. Then I also said I'm going to share some clips of the interview I had. I'm sharing them on the platform. Thank you.
All right, thank you very much, sir. So in the absence of any question or I think it's safe to call it a day in class. Thank you so much, Mr. Ebenezer, for helping us run through the topic today. Please do not forget to fill in your attendance for those who are in class and share what you have learned, and also post it in the group. Post the link, right, of your submissions. I don't think I've noticed that we've been doing that. So please let's make a habit of that. Like I said, we still have I think about 2 sessions to go. Let's try our possible best to make it as interactive and as educative as possible. Right. If you have any questions that you would like to ask post class, you can always drop your questions in the chat box of the main group and we'll get to answer them. So thank you everyone for making it to class today. See you all on Sunday next week. Goodbye and enjoy the rest of your evening.
It's Easter. Sunday is Easter.
Oh, okay. So we may move it to Easter Monday. So sorry about that.
Yeah.
Yes, and before we
It's
go, I
okay.
forgot we are supposed to take pictures. Sorry, let's quickly take our pictures before we go. Yes, thank you, Joshua. Let's quickly take a picture. All right. I can see just 3 people, just Joshua and Ekaite's picture or videos are turned on. Can we have more people turn on their videos, please? Mentees, please turn on your videos so that we can see you. All right, thank you, Zoom user. Sorry. Please, I would like to encourage us. Maybe when next we are coming to class, let's rename. Let's use our name, our real names, right? So that we get to know who you are and not just assume. All right, thank you. All right, yeah, we are done. Thank you everyone for making it to class. Please do enjoy the rest of your evening and bye-bye.
Thank you. Thank you so much.